Okay. Thank you. Good morning, everyone. Thank you. So welcome, Governor Lamont. Thank you so much for coming. I'm Andy Aguinobi. I'm the CEO of Yukon Health, and we're honored to host our great governor as he delivers an important message on behalf of the people of Connecticut regarding the somewhat alarming federal funding cuts for public health in our state. I would also like to welcome and acknowledge our board chair, John Driscoll, who's our new board chair. We're very happy he's here. The University of Connecticut President, Radenka Merrick. Thank you so much for coming. Commissioner Manish Juthani of the Department of Public Health. Thank you for coming. State Senator Saud Anwar. Nancy Navarrete, Commissioner of the Department of Mental Health and Addiction Services. State Representative Christine McCarthy-Vahey. If there are any other state representatives or legislators, could you raise your hands that I haven't mentioned? Just make sure we acknowledge you. Thank you. Also want to any of the members of the Yukon Health Board of Directors or Yukon Health Board of Trustees. Finally, I would also like to thank Dr. Juan Salazar, who is the Connecticut Children's Physician-in-Chief, and Dr. Kevin Diekhaus, Division Chief of Infectious Diseases for Yukon Health, both of whom will speak a little bit later today. Yukon Health is Connecticut's only public academic medical center, and therefore we are proud and fiercely protective of both our own public health mission and public health delivery across the state of Connecticut. Our mission comprises direct healthcare delivery to everyone in Connecticut, including populations who are vulnerable socioeconomically, such as those on Medicaid and the underinsured, and those who are vulnerable from a healthcare perspective, including those receiving mental health and addiction services. Our mission also includes healthcare research and teaching tomorrow's healthcare workforce, both of which are critical elements of public health. Given our mission and long experience, we are deeply concerned because we understand the immense negative impact cuts in federal funding will have on the health of Connecticut. Cuts in funding for public health grants and therefore services only lead to higher costs and suffering in the long term. As such, we applaud the governor for being a champion for public health in the state. Before we ask the governor to come up, I'd like to invite our board chair, John Driscoll, to say a few words, followed by the President, Radenka Merrick.
Thanks, Andy. I just want to reinforce the point that Andy made, that this isn't about just numbers and budget cuts. It's about vulnerable patients, vulnerable children, vulnerable elderly, that cutting through the clutter and the headlines that are coming out every day. When you're talking about healthcare, you're talking about patients, vulnerable people, and care that's at risk right now. With that, I'd like to turn and welcome Radenka to the stage.
Thank you, John, and thank you, Governor and legislator, for being with us. But I really want to acknowledge our doctors, our nurses, and people who stand up so many times to help most vulnerable community of Connecticut. And I do believe in this budget cuts or difficult situation, they are going to stand up again and support this community and provide the best service of the caring. So thank you, everybody, and let's stay together for the great state of Connecticut. Thank you.
Thank you, President Merrick. So I'm going to ask Commissioner of the Department of Public Health, Dr. Juthani, to come up and say a few words.
Thank you very much, Dr. Aguinobi. Thank you to Yukon Health for hosting us here today. For us at the Department of Public Health, it's a very sad day. $149 million turned off and cut effective immediately. We were notified on March 25th that everything was terminated on 6 grants as of March 24th. What does this mean to the people of Connecticut? People saw over the years and days of the pandemic, how much people relied on public health. Whether it was in your community through your local health department or whether it was at the state level. Looking for signs of new diseases that are coming through and those systems that we need to identify them. The epidemiologists that can count how many cases do we have, how many tests are pending. Before the pandemic started, these things were communicated to the State Department of Public Health by fax. That is surprising to some people, but guess what? That was state of the art for public health before the pandemic. We have been modernizing our systems and have invested millions of dollars that the federal government gave to us to get these systems almost over the finish line. And we were almost there. In the next year, we were going to complete systems to be able to identify new syndromes that might be coming into our community, to be able to track cases of measles, of avian flu, H5N1, or whatever the new next pandemic may be. And this stop in funding is going to stop that advance in its tracks. There are things we are going to need to go back to fax to be able to complete. Right here in Yukon Health, we have babies that are born every day. We have a system of newborn screening. Newborn screening performs 60+ genetic tests on children. Every single child born in the state of Connecticut that is then sent to our state public health lab that does those tests. And the new system was going to make that easy to transfer that information back and forth from hospitals to providers, speak with families. We're going to be back to an antiquated system of faxing results. That is a disservice to the people of Connecticut, and this investment that was done in Connecticut will come to a halt. We've had almost all our local health departments getting funding to be able to help identify communities where immunization rates may be low, to go out and speak with people, to try to understand where their hesitation may be, and to try to increase immunization rates in those communities. We've had epidemiologists embedded in local health departments to understand disease outbreaks as they may happen. If there's a school in a given health district where measles immunization rates are lower, in Connecticut writ large, we have a 97.7% measles vaccination rate for kindergarten kids. That's great, but that's not true at every school. You need people on the ground in those local health departments advancing that work. We had to give stop work orders yesterday to all these local health departments. We had to give stop work orders to consultants helping to get this critical infrastructure over the line, stop work orders, so they stop working on these items. These implications for public health are real. They affect every single person in this room and will every day, whether it be you, your children, your grandchildren, your parents, your grandparents. Public health often functions behind the scenes. Public health, once was told to me, saved your life today. You just didn't know it. Because often that's where we're operating. But we work in partnership with healthcare. Healthcare, right, being delivered here every day. We need to work in partnership because that's the way that we can actually make things happen. These cuts that are happening in academic medical centers, that are happening in public health, are going to be devastating to communities. The examples I've given you right now of what the state public health department and your local health department right in your community we're going to do over the next 1.5 to 2 years can give you a sense of the impact these cuts are going to have, not only to people who may lose their jobs right now and in the short run, but also to members in the community that are not going to see the benefits of that work. I thank you for your support, and remember where public health has helped you and your family stay safe every day. I want to end on a note of at least something positive, which is that I always see a silver lining in everything. And I know that with resolve and resilience, which they cannot beat out of us, we will keep fighting for the residents of Connecticut. We may have less tools, we may have less money to be able to do it, but our mission and vision has not changed. And we, as a health department in this state, will keep doing our part the best we can to keep people safe. Thank you.
Thank you, Commissioner. I'm now going to ask Dr. Kevin Diekhaus, Division Chief Infectious Diseases at Yukon Health, to come up.
Good morning, everyone. I'd like to follow up with what Dr. Juthani has said. Basically, it can be summarized as public health matters. Public health programs impact every person, every day, in ways recognized and unrecognized. Now is not the time to reduce funding for programs that support vaccination efforts. These programs are vital for providing accurate information about vaccines, countering the many myths and legends related to vaccines, and directly supporting vaccination itself. Connecticut is currently blessed with the third highest rate of vaccination in children in America. This is the direct result of the success of the programs right here in Connecticut that encourage vaccination, especially in lower income and marginalized populations, as well as to counter myths, pseudoscience, and other disproven theories about vaccines. We only need to look at the current measles outbreak in our country to see the risks of limiting vaccine programs. Currently, I think 378 cases and growing, including 2 deaths. This year already, we've already surpassed the yearly totals for the last 5 years. And notably, 95% of measles patients are either inadequately vaccinated or unvaccinated. So vaccine programs are, in a way, a victim of their own success. It's difficult to conceive of a death that's prevented because it's not right there in front of you. But the reality is that over the last 30 years, routine childhood vaccinations have saved over 1 million deaths in children in our country. The COVID-19 pandemic serves as a reminder to us as the need for public health infrastructure to be robust and to be able to prepare for and then respond to threats as they arise. The rapid development of and deployment of vaccines for SARS-CoV-2, for example, led to saving over 3 million American lives from the beginning of the pandemic. These decisions today are an assault on the health of all of us. They will impact our ability to distribute critical vaccines, especially in marginalized groups that are more likely to benefit from targeted programs. They'll limit our ability to provide vaccine-related education and to counter the pseudoscience and myths that limit our vaccine efforts. They'll eliminate the programs that help healthcare providers identify appropriate patients and maintain real-time records for vaccinations. So in summary, vaccine programs impact the health of all of us as a community, also as individuals. Vaccination programs have been highly effective in reducing the burden of infectious diseases, saving lives, and also providing substantial economic benefits. These decisions announced recently are a direct assault on the health of our society, and I hope that we all stand up and provide our voice that we're against this. So thank you very much.
You can stand up, lady. Yes, so I think next, well, let's have you up next, Dr. Juan Salazar, Connecticut Children's Physician-in-Chief. Thank you.
Thank you, Dr. Aguinobi. Really appreciate it. First thing I'll say to everyone, and I said this 5 years ago as the pandemic started, and I said this through town halls at Connecticut Children's, be not afraid. And that's a message we have to have today. Be not afraid. And let's tackle this with intelligence. Let's work with the people we need to work with, and especially with the people in this state of Connecticut, the governor, what you have done, what you did through the pandemic. We're in a different pandemic now. It's called the P25 virus, and we got to work against that virus. So thank you, Governor. Thank you, Commissioner. Thank you, Dr. Andy, President of the University. Thank you very much for convening us all here. We are, as I am, deeply disappointed to learn of these cuts to critical public health programs. The Commissioner already mentioned them: immunization, infection prevention, and newborn screening. I'm an infectious disease specialist, just like Dr. Diekhaus is, and someone who has studied many diseases, including the effects of COVID and long COVID. And I can tell you that the old adage rings true: an ounce of prevention is worth a pound of cure. Immunizations and public health education are key to preventing the spread of disease, including measles. This is something we don't want to see. I have seen measles. I have seen kids who died from measles many, many years ago. I don't want that to happen again. Now, newborn screening, which is a specific topic that is relevant to us at Connecticut Children's and here at the university, it's really, really important. And many of you may not know about it, but let me just highlight some of the issues. The screening program detects about 60 rare genetic conditions in newborns. It's something that has been established in Connecticut for many years. And if left undiagnosed on a timely basis, those kids can die, and they can die very quickly. The way it works, for those of you who do not know, is a child is born, a nurse does a heel stick on every newborn in the state of Connecticut, about 35,000 kids every year. That drop of blood is then sent to the state of Connecticut, to the Department of Public Health, and they do great work there. They've always been doing this. And for those babies who are diagnosed, many of them receive their follow-up services by a team of geneticists, endocrinologists, infectious disease doctors, immunology experts, many at Connecticut Children's, also at Yale New Haven. And when it comes to identifying these disorders, time is of the essence. If a kid is diagnosed with a rare metabolic disease and you don't know about it soon and you don't inform the provider immediately, that child can die within 3 to 5 days or even sooner. Kids with severe combined immunodeficiency need to be diagnosed on a timely basis so we can actually treat them and refer them for bone marrow transplantation. And that information needs to be coordinated, given in a timely way, much like the electronic health record that you're all used to right now. Your medical record, even whether you're at Hartford Healthcare here at the university or anywhere, it's all coordinated, it's all linked through the electronic health record. We want to do the same for the newborn screening, and that's what the commissioner has been working very diligently with the governor to get this done. And the monies that came in was precisely for that purpose, to automate the system in a way that it's timely. So if you're a mom, a dad, and you have a child and you have an abnormal condition, you don't want this to go through the cracks, that something did not get reported. Fax is not the way to do it. You really do it in a system that's called the LIMS system, which is the Laboratory Information Management System. And that's something that these dollars are providing so we can actually do it carefully. So the funding allocated from the federal government does allow us and is allowing us to modernize testing facilities, improve how quickly the lab can report the results to our clinicians and families, and time is of the essence. So we really need this. This is really, really important. Perhaps we lost the funding, but be not afraid. Let's get the funding back. It's really, really important. This is why it's so critical that we continue to invest in and strengthen newborn screening. So thank you, all of you. Thank you, Governor, for really leading us in this direction. Thank you, Andy, for making this a safer place to be appreciated. I'm here to be with you. Be not afraid.
Thank you, Dr. Salazar. And Dr. Salazar is an example of how everything is interrelated. He's the top physician at Connecticut Children's, but he's also the chair of pediatrics for UConn Health. And so we're all interrelated, and everything affects everything else, and it's very important. Thank you for your leadership. I'm going to invite State Senator Saud Anwar to come up. Thank you.
Thank you, Andy. I want to say good morning, but it's not a good morning. We are in the midst of a disaster. This is a public health disaster. This is an assault on the people of the state of Connecticut. This is an assault on the children, even the newborns in the state of Connecticut. As a Senate co-chair of the Public Health Committee, I'm angry. These were some of our legislative work with the guidance and partnership with our governor, with our Department of Public Health, with the commissioner, and with a stroke of a pen, in an illegal, unethical manner, somebody's taking the well-being of our children and our adults in our state away. Just think about it. When public health institutions and systems are broken, we see the results immediately, but the results continue to show their ugly face for decades. It takes a lot of effort to build up institutions, but somebody wants to break those institutions, that happens pretty fast. So this is not normal. This is not acceptable. Whether it's education, which is healthcare, everything that is dear to us is under assault. And this is not a sustainable model by any means, no matter who can assess this. Yesterday we spent about 5-6 hours in the Public Health Committee, we're trying to pass, and we passed Senate Bill 7. And the Senate Bill 7 had parts of our effort where we were anticipating something like this was going to happen. And the amazing thing was that my colleagues in the legislative branch of the government were fighting and saying that you are not recognizing that there's nothing wrong. And right in the midst of that conversation, we heard that $150 million were taken away from our Department of Public Health, an institution right after the pandemic that has done heroic work in the state of Connecticut to save lives, and for our colleagues to even not recognize, and when invited, don't even show up here. We have problems. And perhaps what we are seeing right now, and in the form of this public health disaster that has been created, is part of that problem, that there is an alternate reality for some people. And but it's time, and as a physician, I say that, you know what, you can say anything to me, but when you come after my patients, it's war. It's war. Thank you.
Thank you, Dr. Anwar. If I could ask the Commissioner of DEMAS, Nancy Navarrete, to come up. Thank you.
Good morning, everyone. I am Nancy Navarrete, and I'm the Commissioner of the Department of Mental Health and Addiction Services. So the work that I do is adjacent to what my colleague at Department of Public Health does. This unanticipated and sudden cessation of these block grants that we received notice of will be immediately disruptive to the behavioral health system in Connecticut. These resources were previously deployed by DEMAS in a very intentional way a couple of years ago to assist providers in handling the COVID pandemic and its latent impacts based on a timeline that was clearly established and articulated by Congress and the United States Treasury. Now, with only months remaining in a several-year program, the rug has been pulled out from under our clients and the hardworking nonprofit professionals who provide care to our residents. Since finding out about this cut on Monday evening, with an effective date of Monday evening, DEMAS staff have been working tirelessly to assess the potential impact. Unfortunately, we are facing many unanswered questions. As of Tuesday, invoices were not being paid. Yesterday, we were notified that SAMHSA was working on guidance. There was no planning, and there is still no certainty as to the meeting of our 3/24 deadline. Nevertheless, it is fair to say DEMAS's clients and providers are going to face cuts totaling in the millions of dollars without any prior notice or warning. We will continue to work to identify solutions to mitigate these unfortunate cuts to the best of our ability. To give you an idea of what kinds of services may be affected, it could be linking folks that are unstably housed to services and employment supports. It could be a regional suicide advisory board member that is in your community who, when you experience a spike in your community, would be able to report into the department, which is a collaboration with our DCF partners, to find solutions to help young people and young adults. Harm reduction centers could be affected. Our harm reduction centers have been really key in getting out life-saving naloxone wound care, for example, in communities. Perinatal screening for substance use and mental health services. Early intervention and treatment for individuals who are experiencing the first episode psychosis in their lifetime. This may be a young person in a family who is struggling to understand what is happening with their mental health. Those kinds of services may be interrupted. Medication-assisted treatment. We still have an opioid crisis going on. We're doing better but we still have an opioid crisis. And access to those medications are important to keeping that overdose rate down. We know that our nonprofit providers already have limited resources, and we were counting on this revenue to continue these critical programs. Simply put, DEMAS and our provider system are the behavioral health safety net for our state's residents, and the closure or halting of a program will be tremendously harmful to their care and will be destabilizing to the population that is working with every single day. These are life-saving and life-changing services for our state's residents who are seeking help at a very vulnerable time in their life, all which was exacerbated by COVID. So in the hours and days ahead, there will be uncertainty in the system, and we will be working closely with our providers, our partners. Thank you, Governor Lamont, for supporting Health and Human Services, to work with them to try to mitigate this damage that has been done and continue these programs for as long as we can. Thank you so much.
Thank you. And if I could ask State Representative Kristen McCarthy-Vahey to come up. Thank you.
Thank you, Dr. Aguinobi, and thank you all for being here. As legislators, together with Senator Anwar, we work very hard to be thoughtful, to be measured, to be solution-focused, and to bring all the stakeholders to the table when we make decisions. That is not what is happening with our federal government. The decisions are dangerous. They are irresponsible. They are not well thought out. They are not being done in a measured or decent way. They're cruel. They're cruel. I'm not a medical provider. I am a mom. I'm a sister. And when we talk about the work that's done, for example, just with vaccines in our communities, we have flu clinics in Fairfield. I go get my flu shot at the senior center every year. I'm there with my neighbors. I'm there with the seniors. I'm there with our firefighters, with our DPW workers. And I'm there with people getting shots that will save their lives. And why do I have so much emotion in my voice? Because last year, I lost my 43-year-old brother-in-law to the flu. He had no underlying health conditions. He died from the flu because flu still kills people. But what saves them? Vaccines. Vaccinations save lives. But we are facing misinformation, miscommunication. The media market is being flooded, social media is being flooded with misinformation. When we don't have the resources to combat that misinformation, when we don't have the people, the human beings in communities, you as medical providers, you know that trusted relationship as the provider, that's what gets the message across. That's where people go. We can talk today, and we are talking about dollars, about invoices, about epidemiologists, about experts, but these are our family members, folks. These are our children, our parents, our neighbors. These are the people we love. That's what these cuts mean. These cuts hit at the heart of our communities. We are afraid, but you know what? We will walk on. We are heartbroken. You can see it and hear it. I am crushed by what's happened to my family. And I am enraged at the cuts that will have impact in everyone's lives in ways that they do not know. But you know what? I have a little weeble wobble on my desk. Some of you are old enough to remember that. We will walk on, and we will walk on together. We will have to make difficult choices, but we will work together. And I just told the governor, I'm incredibly thankful for you, and I maybe shouldn't say this out loud, but today I thought of a new nickname for our governor, Steady Nettie. Because you know what? He has been that steady force who has continued to be thoughtful, to be measured, to bring the stakeholders to the table, exactly the way our federal government is not. So, Governor, thank you for your leadership for all of us, and thank you to every single person who is persisting in the face of this fear, this confusion, and all the stress. We will get through this together. Thank you.
Thank you very much. I'm going to stick to Governor Lamont, but this is a good segue to the main event today, which is one of just the absolute pleasure we have in welcoming the governor here to say a few more thoughts. So, thank you, Governor.
Well, good afternoon, everybody. And you said some of you aren't old enough to know Weeble Wobble. Maybe some of us are too old to know what a Weeble Wobble is, but I'm learning. And I want to say to each and every one of you at UConn Health, thank you for what you do on behalf of the people of Connecticut, keeping us safe, keeping us healthy. It's great having Andy Aguinobi back by popular demand, freshly minted chairman, John Driscoll, and everything you're doing. Every day, trying to be steady, dealing with an unsteady stream of incomings from Washington, D.C. You know, if the DOJ Commission is all about waste, fraud, and abuse, sign me up. But it's doing a lot more than that. If it's really about, you know, pushing responsibilities more onto the states, say education, don't disguise a cut that way, but we can live with that. But when it comes to public health, we need national leadership. We learned during COVID that there are no borders. And we're in this together, and we're all God's children. And if you're not tested, if you're not vaccinated, it's unsafe for you, it's unsafe for your family, it's unsafe for your neighbors, it's unsafe for your community, and that's where we're headed. I think this is the most ill-conceived cut that I can imagine. It was just 5 years ago we were going through COVID hell, just 5 years ago, that we said we're never going to let this happen again. We're never going to be caught as unprepared as we were 5 years ago. There was nothing in that stockpile down in Washington, D.C. We were, and over the last 5 years, we've been able to make some efforts there. Look, you heard Manisha say, we're one of the most vaccinated states in the country, thank God. That doesn't just happen. That happens because of some of the federal grants that we had were out there in every one of these communities. We're building up our local public health departments. We're going to those communities that have a certain vaccine hesitancy, the least likely to want to get vaccinated, telling what it means to you, your family, and your community. And we're going backwards right now. We're going backwards when we say this is not, the feds are going to walk away on this. We're going to cut the funding, and states, you're on your own. Today, they cut 10,000 people out of Health and Human Services. Yesterday, they cut vaccine support for countries around the world. You know, COVID didn't happen down the street. COVID happened elsewhere in the world, and there are no borders. This is why you need a federal government to step up. We're there as your partners, but it's just insane when something like this gets shortchanged and put off, and that's where we are today. So I feel the pain and the fear that I hear in each and every one of you. Have your voices heard. What I do is I work with not just blue state governors, I work with red state governors. I say, this is what it's going to mean to you. This is what it's going to mean to your community. Think how you were hit in your community 5 years ago by COVID. We're not going to let that happen. And we're not going to let that happen in Connecticut. And I need your help down in Washington, D.C. to make sure it doesn't happen here as well. Thanks for everything you do.
We'll take on-topic questions from the media.
Great.
Is it just, the total so far is 149 million, is that right?
Yeah, 149 million, I think, over a couple of years.
And it was very sudden, we were not expecting.
Very sudden. I mean, we're right in the middle of a number of projects. Manisha's got an IT project so you can get the latest genetic information to a central place so we can make sure those babies are safe. We got to figure out how to get that project finished. A lot of this is data, so we can do some testing, so we can see where that next virus might be coming on and how we can target that. These are all things that the feds were taking the lead on. Now they've stepped away.
Governor, could I just clarify something? You said 149 in public health. Commissioner Navarrete is still counting, but it's in the millions, which would assume
About 6 million, Nancy?
in DEMIS. Have you heard anything yet from DSS or DCF, and do you know yet if they could be affected?
We don't know. Every day we're in contact with Washington. I know some of the secretaries down there in the Trump administration. They're not sure. Everything runs through the White House. Everything runs through DOJ. The greatest risk probably is going to be a Medicaid. That's the biggest number, and that's where we're following that very carefully. SNAP benefits also at risk.
But I meant in specifically regarding this clawback, we don't know yet if DSS or DCF are affected by this particular clawback.
I don't believe they are. Not yet.
I know you've all laid out what this money is for, but just responding more directly to the HHS saying this is reclaiming money that was spent on COVID, we're through the pandemic. Just anybody who wants to respond to that characterization of this cut.
Want to take that, Andy? I can take it.
Oh, yeah, you go ahead and take it, Governor. I think you're more important to do that.
Look, originally this was what we learned coming out of COVID. Right now it's a lot more than what it is related to COVID. This is what we got to do when you see avian flu, when you see measles, you see what's happening all around us. Every one of our neighboring states has some symptoms of measles. So this is much bigger than COVID. It's what we learned from COVID to make sure this never happens again.
Dr. Giussani, did you want to speak? Oh, okay. He's perfect. All right.
Will this affect vaccination?
Manisha.
You want me to take?